So I'm so excited for our chat today. We've got Dr. Sujay Kansagra, and he is the man behind one of my favorite Instagram accounts, the popular Instagram account at That Sleep Doc. I, as a certified pediatric sleep coach, am a total sleep nerd. And so I really appreciate what Dr. Sujay shares with us because he makes us laugh. He makes us wow and wonder at all the crazy facts and science behind sleep. So I'm so excited to have you here with us today, Dr. Sujay.
It's great to be here. Thanks for having me.
Yeah. So why don't I'll let you kind of introduce yourself and
Sure.
tell my audience kind of who you are.
Absolutely. So by training, I'm a child neurologist, and I did additional fellowship training in sleep medicine. And so really I focus on sleep disorders in children. I'm a professor at Duke University, and I'm the director of the Child Neurology Sleep Medicine program at Duke.
So you're saying you know a little bit about sleep.
A little bit, yes, a little bit.
Just a little.
No, I kind of joke. Sleep is my life. When it comes to treating patients, when it comes to doing research, when it comes to educating about sleep, this is just what I do.
Well, I find sleep so fascinating because we know so much about how important it is for us, like as humans, but still there's so much that we don't know. And I just think that's so cool. Like in this day and age where everything, we're like so advancing so fast and everything. I just think it's cool that there's something that's so important and integral and innate to us that still there's so many mysteries around it.
That's one of the reasons I got into sleep, which is there's a lot to learn. And so we talk about, I know a little bit about sleep, but I also realize how little I know about sleep because there's so many things that are yet to be learned and researched. And so it's a great field to be in.
It's so cool. That's so neat. Well, okay. So we're going to jump in. I've had a lot of questions submitted from followers on Instagram. So we're going to get into some of those. We're going to get into some of the deeper, hard-hitting questions. But let's kind of start at the foundational level. So can you talk to us a little bit about what science tells us is the importance of sleep? Because lots of times, I hear from families who are struggling with sleep challenges with their toddlers and preschoolers, and they're really concerned about trying to hold boundaries and worried about the pushback that they're going to get from their kids. And so I try to spend a lot of time explaining to families that sleep isn't just kind of like a nice to have, or like maybe one day, we'll sleep, that it's really part of the foundational biological needs that we all have as humans. So can you tell us a little bit about what science tells us?
Yeah, no, I love that. It really is kind of a foundation for our health. We know that if you don't sleep, just about every single like medical, behavioral, psychiatric condition gets worse because sleep is a biological imperative. And if you look across species, it's an evolutionarily conserved part of animal species, and so we know it's vital. And if we think about it, even just from an evolution standpoint, when you're sleeping, you're not really doing anything to promote your survival. That's what evolution is all about. What do you do to promote your survival? You're kind of a sitting duck for predators, et cetera. So if you look at it from just an evolutionary standpoint, there's got to be a really good reason why we sleep, right? There's got to be a really good reason why it promotes our survival. And the reason is because it does so much for the development and the continued maintenance for our brains. And there's no one single reason why we sleep. The more that we research it, the more we realize it touches on just about every system in the body. But we know that some of the goals, as far as when it comes to children, we know that they're doing a lot of their kind of brain development in the sleep stage. And so young children that are developing very quickly as far as their brain development, they tend to sleep a lot more. And that sleep over as we age starts to decrease. But a whole host of things happen. And one of the main things that impact day-to-day life for children is how much sleep impacts behavioral regulation. Because we know that when you don't sleep, have poor quality or quantity of sleep, behavior tends to be the first thing that suffers for children.
And parents maybe too.
That's right. Yeah. Here's some funny nerdy sleep science, which is, we know that our prefrontal cortex, which is the frontal parts of our brain that are in charge of all the rational decision making, executive function, our ability to kind of process and react to our environment, that is tied into our amygdala, which is the emotional control center. And those ties are pretty tight, but if you don't sleep, that connection is affected. And so we're much more likely to react emotionally, and parents know this, we're much more likely to snap if we haven't slept well and have a much shorter fuse. And so there's some real kind of science to explain why sleep does that to our behavior. And for children who already don't have a developed prefrontal cortex, so much more important, to make sure that bond is tight and they're getting the sleep that they need.
So it affects behavior. We can definitely see that, behavior is affected when there's like a lack of sleep, but also doesn't sleep help with consolidating memories and learning? So when you, like everything that you've experienced during the day, isn't when you sleep kind of when you form those into actual lessons that stick with you?
That's right. We do think that a lot of our short-term memories are put into long-term memory banks during the process of sleep. And similarly, we know that sleep is important for forgetting as well. And so, we don't remember what we had for lunch 5 days ago because your brain forgot that while you slept, because you don't really need that. And you need to, I guess, do some cleaning, right? To make sure your brain has the space for what it really needs to remember. And so, yes, also very important for learning and memories.
Okay. All right. Great. So sleep is not just a nice to have. It is a very important, it's a very important function
Correct.
for all of us.
Absolutely.
And when we talk about sleep, I guess let's mention this too. So I talk a lot about quality of sleep, which is consistent sleep, meaning you're going through your sleep phases one after another consistently. So, because, some families will say, well, my kid is in bed from 7 to 7, but they're awake for an hour from 10 to 11 while they're, I'm trying to get them back down to bed. And then at 2 a.m, they're trying to come into my room. So sleep is really fragmented. So does fragmented sleep actually negatively affect the quality of the sleep?
That's a great question. And this is where, the science gets a little bit more nuanced. And I would say, surprisingly, we don't have a lot of great data that says that, if you're sleeping in chunks, that sleep is much less restorative than sleeping in one consolidated chunk. And so, for example, infants, they sleep in chunks throughout the day, sleep in short periods. And so the fragmentation itself is probably not that huge of an issue. And in fact, even for adults, the thought was before the Industrial Revolution, we slept in 2 sleeps, a first sleep and a second sleep, and had a chunk of time in between where we'd socialize and, do all sorts of stuff. So the whole notion of having just one consolidated chunk of sleep, it's what we tend to do here, but there's no great science that says you have to sleep in one big chunk. Now, that being said, if you're having frequent nighttime awakenings, and those awakenings end up eating into the total amount of sleep that you get, then certainly that's a problem because quantity is important. And so when I say fragmentation may not be a huge issue, that's under the assumption that you're still getting your 24-hour sleep need. But unfortunately, long awakenings, some of these behavioral issues that come up for our toddlers, that ends up cutting into the quantity, and that's where we run into problems.
Okay, so it's really the quantity that's the most important piece.
That's right. In my book, I would focus on quantity, but at the same time, I think, we have a chunk of time dedicated to sleep for children. And we know that, schools and daycare, all that can start very early. And so we're up against a little bit of a roadblock in the morning. And so toddlers can't just sleep in, and school-age children can't just sleep in. And so that's when practicing some of those skills and helping with consolidation can be very helpful. Ensure that long term, if you have those skills, then you're able to, I think, more readily get the quantity that you need.
Okay. All right. Very interesting. So you are, you're a sleep doctor and I am a certified sleep coach. So we kind of help parents and we have a lot of overlap and, obviously wanting to promote healthy sleep and encourage parents and children to get all the sleep that they need. So what are some situations where a parent might need to hire like a sleep consultant to help them with behavioral sleep issues versus sleeping help from a medical professional? So what are like some common symptoms or situations where parents might say, oh, might need to a doctor for this kind of help?
Yeah, that's a great question. I'll tell you that it probably depends on access to care for you, depending on where you live. So, when it comes to sleep physicians, we are happy to help with some of the behavioral strategies for sleep. There are also the other group of professionals here. We have lots of sleep psychologists that also do a lot of the behavioral interventions for sleep and are excellent. And so there are lots of pockets of sleep expertise out there. If, in my clinic, typically, when I first started, I was seeing some of the more typical behavioral issues with sleep onset association issues for infants and limit setting issues for toddlers. Over time, the clinic has shifted to more of an intractable insomnia clinic for children that have other neurologic comorbid conditions. So I'll have children that have had, for example, a hypoxic ischemic injury at birth, have intractable seizures, children that have genetic disorders that are associated with neurodevelopmental challenges, and sleep is often affected. I see children on the autism spectrum very frequently that have challenges with sleep. And so when it comes to, I think this is going to involve more than our classic behavioral strategies. And you may end up needing potentially even, medication intervention, consideration of a sleep study, if you heard about sleep apnea, these are situations where it's great to see a sleep physician, or sleep professional. But when it comes to our world of sleep consultants who tend to be huge advocates for the sleep science and the behavioral approaches for sleep, I always say you want to, make sure that your sleep consultant is abiding by what we know about the sleep science, because there are lots of different approaches out there. And even among sleep physicians, I say there are probably some differences in approaches. But as long as who you are getting advice from is a believer in the science behind sleep and is keeping up with the science behind sleep, that's the main goal. And they can provide a lot of one-on-one guidance to personalized intervention for your child. Because it's not I see them one time in clinic and unfortunately I have to see them again in 3 months. But the questions are day to day to day. And you need someone that can help kind of partner with you and walk with you through that back and forth. And that's where I really I love my sleep consultant friends and colleagues who are great with that.
What are some symptoms of like in neurotypical kids that you would recommend seeing a doctor? So, because I hear about these things sometimes, and I think snoring is kind of like the biggest red flag, right? If you have a loud snoring child.
Yeah. I mean, if you have access, we're happy to see you for any sleep issue, and so there's no cutoff. If your primary pediatrician does not feel comfortable with the sleep issue and they think they need a specialist, they're usually the gatekeepers to get them into the sleep medicine clinic. So it really ends up being kind of your pediatrician's call. But I agree. Certainly if a child is snoring and has some sort of daytime manifestation or a sign or symptom of obstructive sleep apnea, that's a good reason to get into a sleep lab for a sleep study or come see a pediatric sleep doc. Or other medical sleep disorders like restless leg, for example, for older children, oftentimes confused with growing pains. This restless leg is much more common than we think amongst young children and often diagnosed very late. So that's another reason.
How does that manifest? What is that? How would the kid be describing that or the parent?
Yeah. So the challenge is the younger you are, the harder it is to describe. But there are 4 key criteria when it comes to restless leg, which is you have an abnormal sensation in your legs. It tends to be worse or only present at nighttime. It improves when you move your legs, and it gets worse when you stay still, and you don't have any other underlying neurologic issue like a nerve pain or a neuropathy that could explain those symptoms. If you meet those criteria, you have restless leg. You challenge children, particularly young ones, sometimes it's hard for them to describe this very weird, ambiguous kind of sensation, this nebulous feeling they're having in their legs, and they say, "Oh, my legs hurt." And everybody's like, "Oh, well, you probably ran around a lot at night or during the daytime, and you're just, your muscles are tired, etc." But that sensation can keep them up at night, and they feel really restless, and their sleep is disrupted because they can have limb movements in sleep as well. And so, but those are the 4 clinical criteria. And if you're concerned, the main thing that we do is we check for iron levels because we know that low levels of iron can predispose you to having restless leg.
Okay. All right. Thank you for that. Okay. So let's jump into kind of like the deep end for a second, and let's talk about kids and crying as it relates to sleep training or helping your child learn how to sleep independently. So I think crying is one of kind of the biggest concerns that parents have that I hear about all the time, which is, if I really want to work on kind of breaking some of the associations that my child has, with me sleeping with them or staying with them while they're falling asleep, I'm really worried about them crying because I've, heard that crying can cause brain damage or it can cause psychological issues later in life, break the attachment that I have with my child. So that's, I think, one of the major objections. So does science give us any guidance as to how to handle this?
Well, we have a lot of great studies when it comes to behavioral interventions for difficulty sleeping for infants. And so what we call, sleep onset association subtype for behavioral insomnia for childhood. And the whole question behind crying is, first and foremost, nobody wants infants to cry. And in my book, sometimes when you undergo these interventions, I say that we're actually trying to prevent crying because, having to wake up multiple times and get caregivers' attention because you can't fall back asleep on your own may also be a little uncomfortable for the child. And so I equate it to if you get comfortable falling asleep on your bed and then while you're asleep, somebody wakes you up and puts you on your kitchen floor and you wake up on your kitchen floor and you're going to look around, you're not going to be happy about that. Similarly, if children are used to falling asleep in a certain environment, a certain set of circumstances, and then they wake up in the middle of the night and those circumstances are no longer there, they're not going to be happy about it,
Right.
and they express that discontent with crying. So our goal is to teach them how to become self-soothers. So they don't have to cry. They rely on their own mechanisms to get back to sleep, so long as they've hit a certain age and, are otherwise healthy, growing well, etc. The science behind outcomes when it comes to what happens with sleep training, in the data, there's really no debate. The debate is really amongst in the social media world, and because everybody feels really strongly about things. The data shows that there's no debate. If you're a believer in the science of sleep and the data behind sleep, there's zero debate about sleep training. So there was a great meta-analysis done that looked at, I believe, 52 or 53 well-designed research studies that showed behavioral interventions for difficulty sleeping in infants. Of those, 49 showed benefit, and the other 3 or 4 showed no harm or no benefit, and with 0 studies showing any harm to the child. They have good long-term, 0. They have good long-term outcomes and look at 5 years down the road regarding what happens with children when it comes to a whole host of psychophysiologic kind of metrics. And so that includes things like, anxiety scores, depression scores, parenting perception of sleep, etc. And the interesting thing to know here is that when you look 5 years down the road, there's no difference when it comes to any of what we perceive as harms. There's no difference between children that were sleep trained and children that weren't sleep trained. Now, at the same time, I will also say there's no difference in sleep either. And so people say, oh, you have to sleep train. I'm like, no, you don't. You don't have to sleep train, because if you look 5 years down the road, it's all a wash, because there's lots of other things that factor in. And so my approach here is there are actually very clear short and medium term benefits to sleep continuity, parent perception of sleep. When it comes to maternal depression scores, when actually there are even studies showing attachment improves, which makes sense, because if everybody's well rested, you're much more likely to have that bond with your child. Marital satisfaction. I mean, there are many, many things that actually improve when children are sleeping better in a short and medium term, without any long-term data to say that, oh, everything is going to be roses for the next, 100 years of the child's life. But there's no data to show any harm, short, medium, or long-term harm to children with sleep training. And I'm happy to delve into, cortisol and all this stuff, because there's a lot that we can kind of unpack regarding the study that led to those concerns. But there have been great studies performed afterwards that also show that the whole cortisol story is a big whopping nothing burger, is what I say. It's a big whopping nothing burger. There's just nothing there.
Okay, well, I think hopefully that is like really reassuring to parents. It aligns with what I say a lot of times too, which is that in my experience, I mean, I've been doing this for 8 years, and after talking to families, I actually find that there's less crying when you have a plan, when you are have a consistent plan. You're doing the same thing night after night. Your child is getting used to a new experience. New experiences are hard. They can feel different. They can feel a little bit unnerving. That's why they're crying. But the more consistent you are with giving them a new experience, the crying only lasts for a little bit of time, compared to potentially months or years of parents dealing with, stalling at bedtime, taking an hour for kids to fall asleep, middle of the night tantrums, waking up at 5 o'clock in the morning, all of these things that are really causing, not only a lot of crying, but also a lot more issues when in the family, as opposed to just having a plan, sticking with it for a couple weeks and getting to the end of the process.
100% agree. I mean, we have some great examples of consistency in parenting where children do not like what we're doing. For example, putting them in a car seat, right? In the car. They don't like being strapped in. They want to probably be held and rolling around in the back seat and doing their own thing. But we don't allow that, even though a child fusses and cries when you do that for the first 2 or 3 times. And guess what? I mean, they stop. They're like, okay, this is how it's going to be. And and then they're fine, right? The children are incredible. They're brilliant. I mean, you have these minds, parents always feel like their children are geniuses, because every day they're coming up with all these new things, and it is remarkable what they're able to do. And so, yes, when it comes to skills like being able to self-soothe and understanding consistent routines from families, they will, in most cases, can learn very, very quickly, as long as you're implementing those in the right way with the appropriate expectations in mind, and the level of, kind of support that they need based on their temperament and their underlying potentially anxiety levels, et cetera. So, yes, consistency is incredibly important. Learning new things can be challenging, but I agree with you. The long-term goal here is to prevent crying and make them enjoy the process of falling asleep and staying asleep.
Yes. I mean, I love that you just said the word enjoy. Like, that's part of my goal too, right? It's like, hey, like, I know when we were all like about to have a baby, we didn't imagine that it was going to be something we dreaded every night, putting them to bed. We didn't imagine that we were going to be having to chase our kid around the house and beg them to sit in our lap while they were screaming. No, we imagined it would be nice and it would be lovely. And we would, read books together and we would sing songs. And it can be like that.
It can
It
be like
really
that.
can.
Lovely for parents, lovely for the children. It should be sleep should be a welcome friend at night. That's the goal, a welcome friend, not a
Yep.
foe. Yeah.
Yep, totally. Well, okay. So you mentioned anxiety a second ago, and I think that's what I wanted to talk about next. So another thing that happens is really common with, I specialize in kids who are 3, 4, 5 years old, and we hear a lot about fears. Kids might be scared of the dark or scared of monsters or just scared of something that they can't even verbalize. Separation anxiety is something I hear a lot as well. As I understand it, these are very normal parts and feelings associated with childhood. And honestly, a lot of these are really good opportunities for kids to learn some self-reliance skills as parents, can reassure them that there are no such thing as monsters, and things like that. But when should it be a red flag to parents that maybe there is something more than just kind of a normal age appropriate fear that's going on? Or
Yeah, that's a great
how do you
question.
help parents handle that kind of
Yeah.
situation?
Yes. So, for young children, toddlers in particular, a lot of, if they have an intrinsic disposition to anxiety, oftentimes it presents as separation anxiety very early, right? And so a lot of difficulty. And of course, there's going to be some difficulty with separation, when you're first dropping your child off at daycare for the first time. And those are all normal reactions, et cetera. But if it's persistent to the point that it's causing, weeks and weeks of challenges, you got to think, well, maybe my child has some underlying separation anxiety tendencies or some generalized anxiety tendencies. Do they fixate on routine? Do they get really, does it really bother them when you do things out of routine? Do they end up asking frequent repetitive questions, even though you try to reassure them? Is there a family history of anxiety? So anxious tendencies, we know that there's a genetic predisposition. So if we know that a parent has significant anxiety, it's possible that the child could have similar anxiety. So, and then oftentimes is actually also reading the child. So I'm always wondering, is there bedtime related anxiety, in which case it affects the method that we'll use to help them with sleep, transitioning to sleep, particularly with toddlers. Parents are usually pretty good at perceiving what is a delay tactic versus what is true anxiety by reading the expressions of their child. And so I'm often relying back to them to be like, does your child seem truly scared? In which case we don't just want to pursue that and say, okay, too bad, it's time for sleep. We want to build their confidence in the sleep environment and make sure that they feel safe, secure while we're going through the nighttime equation. And so a lot of it comes down to the parent perception of how the child is doing at night. So if they have no evidence of any anxiety during the day, that's step one. Are they generalized? Are they anxious throughout all the time? And then I'm focusing just on sleep and saying, okay, if they're really fighting hard against you just at sleep, do you feel like in that situation they're anxious or worried about something like the dark or being alone, etc., or do you think they're just pushing their limits? And oftentimes, if it's a child that doesn't have any evidence of anxiety during the daytime, sometimes it's just that they're pushing limits and they're trying to see what they can get away with. But again, if they are truly anxious, then we'll work on slower techniques.
Yeah, slower techniques. But so it's not to say you shouldn't want to encourage sleep independence if that's part of what you want as the parents. It's just maybe you would use a strategy that is more gradual, gives the child more assistance as you go through the process.
100%. And I love the way that you just phrased that, which is if this is something that parents want to do, which is another, there are personal and cultural differences regarding the setup for toddlers. For infants, we kind of draw somewhat of a hard line and say we think that bed sharing is unsafe for the child based on the data that we have. But when you're hitting a toddler age, sometimes parents prefer to bed share with the child. If that's what they want to do, then by all means, and if everyone's sleeping well and that's working for their family, great. If they want to make a change, yes, even if they have a child that has some anxiety, there are slower, effective techniques that can work them build those independent skills. Because again, even with anxiety, we don't want to protect them and put them in this bubble. That's not how we deal with anxiety. We still give them some challenges and build their confidence and their ability to tackle these challenges.
Exactly. Okay. I really like the way that you explain that. And what I was going to say too was when kids at night and they are starting to talk about, fears or they don't want to be alone and they kind of are getting very clingy at night, that can also be a symptom of overtiredness. Yes.
So we do see children that certainly, what I'd call go back a year or two regarding their developmental state when they're starting to get tired at nighttime, right? So they might resort to, more emotional kind of pleas and appear to be holding it together less than they were during the daytime. And that can definitely be a sign of being overtired. We know that children, we talk about this concept of overtired, but what it ends up likely being is that we're hitting kind of like the peak in our circadian wakefulness at nighttime. And so our circadian rhythm gives us different alerting signals and it peaks right before it's time to go to bed. But the other thing that's kind of helping offset that is that throughout the day, there's another sleep drive called the homeostatic drive, which is building up and making your brain feel sleepier and sleepier. And so then at nighttime, we come up with this mix where the homeostatic drive is very high, wanting you to go to bed. Your circadian rhythm may be a little bit high at that time, wanting you to stay awake. And then that develops a bit of a push-pull in your brain, and the child is having a really hard time. Now, in that situation, sometimes it does help to move bedtime earlier, try to get them before that little peak in the circadian rhythm is hitting you, and they get that second kind of wind phenomenon. Try to get them settled before that peak occurs so that they're asleep before that circadian peak. So, anecdotally, I'd say yes, people oftentimes see that as being overtired, but it's probably just the play of the homeostatic and the circadian drive making your brain feel, a little bit out of control at times.
A little conflicted. Yeah. Okay. Well, I love the way that you describe that because I'm just over here saying, put him to bed earlier, put him to bed earlier, put him to bed earlier. Like, yes. I feel like that's what I'm saying is the solution to like all problems. But
well, it's funny because toddlers by nature just tend to be early birds, right? I mean, they tend, like a 5, 6 o'clock wake up time is not unusual for toddlers, and parents like, well, what is my toddler doing? Why are they doing? But by nature, they tend to be morning birds. Teenagers tend to be night owls. And then when you hit your 70s and 80s, we tend to be morning birds again. So your pattern naturally fluctuates throughout your life and it goes in these general directions. But for toddlers, yeah, they tend to be morning people for sure.
Morning people, which means they need to be having the opportunity to go to bed earlier because they're going to get up they're going to be up at 6 a.m.
That's right. Yep. A 7:30 bedtime is very appropriate for toddlers in most situations. Again, depending on, where you live in the world and the light exposure and stuff, but a 7 to 7:30 bedtime is very appropriate.
Okay. I love that. Yep. I'm telling everybody that their kids need to be asleep by the time it's 8 o'clock. That is the goal.
I love it.
All right. So we had a question come in about naps. So kids are between 3, 4 years old. That's the time when kids kind of tend to drop their naps, but there's a lot of bedtime drama associated with naps. It seems like once kids hit kind of like the 3.5 mark is where I feel like this really starts to happen, where maybe kids have to take a nap at daycare and then they can't fall asleep until too late. So do you see that how naps affect bedtime, and when do you recommend that parents try to like drop that nap?
I say that, there's so much variability from child to child. So yeah, typically, I've seen somewhere between 3 and 5, but some children, even into like, close to 6, may still be wanting that nap. I think it really just depends on individual differences regarding, sleep need and their overall kind of sleep drive. My goal here is if your child is consistently able to fall asleep around that nap time, around noon, 1 o'clock, then give them the nap.
They still need it. Yeah.
That's right. Yep. And I wouldn't fight through it. So I like the whole concept of naps as long as you possibly can, because then we live in a world that's napless, and then we wish we had them again. But naps are totally fine, as long as they're not too late or too long. Again, that all depends on kind of your goals for the night. And so if a child is falling asleep at 2 o'clock and sleeping until 4:30, probably not the best situation to get your child to sleep by 7:30, 8 o'clock. They're likely going to be up till 9:30, 10 o'clock in that scenario. So I'm trying to give a good chunk of time for most of our toddlers. And you could think of it as, somewhere around 4 or 5 plus hours of wakefulness from the waking up from their nap to their bedtime to help build up that sleep drive again. Now, there are different ways to tackle this, particularly the daycare scenario. And you also share a lot of this content, which is you can talk to daycares and see what kind of flexibility they have regarding, perhaps giving them other activities to do, putting them to their cot a little bit late, waking them up a little bit early from the nap, et cetera, moving them to another room. I think all that is great advice. I would say that ideally still trying to shoot for that nap around noon, which tends to be when our circadian rhythm takes a little bit of a flattening / dip and makes us feel sleepy anyway. And ideally being awake by 2 or 3 if we're going to shoot for that 7:30-ish bedtime.
Okay, this sounds like exactly what I'm telling people to do. So we're on the right track.
We're on the same page. Yep.
Yeah.
It's amazing when you look at the sleep science, everybody's approaches can be very similar. Because I think that there's some good guidance in the science.
Yeah, well, yes, science doesn't lie. Science tells us, helps us understand what we need.
That's right.
Yep. Okay, so let's see. Another question I got here is, when do you suggest that kids move to a big kid bed? Is there a certain age?
Yeah, great question. I always say wait as long as you can, as long as it's still safe for your child. And so usually crib manufacturers will have safety instructions, and it tends to be when the top of the crib rail is around the nipple level, that's when it's time to move into a toddler bed. Or if if they're actively trying to get out of the crib and are able to make it over the rail, that's also a safety consideration. But in the absence of those two things, I say wait as long as you possibly can, ideally as close to 3 as possible. Because one of the big mistakes I see is, a kid is 2 years old, they're getting kind of squirrely in the crib. Maybe they're having a quote unquote regression. The parent's like, maybe they're ready for a toddler bed now. They take them out of the crib and it's almost always a disaster. It's almost always leads to a lot more heartache and trouble. And so, the longer you wait, the more likely the child is going to be able to develop those skills to kind of control that behavior at night, to understand what's going on, to know that, okay, now I'm transitioning to the toddler bed and this is the expectation. All the things that, we associate with being independent sleeper when you have free reign to leave the bed, all those skills develop as you get older. And a 2-year-old is not really going to be ready for that, in my opinion. So I say wait as long as you can, and wait ideally when sleep is in a good place. When the child has gotten a great routine and feels comfortable sleeping and is sleeping well and fairly independently through the night, that's a great time to consider transitioning to a toddler bed.
Okay, great. Another place where we're aligned. I say wait till they're at least 3 years old if you can, if it's safe, or somewhere between 3 and high school is like when you should move them. That's
I haven't run into many high schoolers still in the crib, thankfully. Yeah. But no, yeah, I agree. As long as safety is not a consideration, and then by all means, longer is fine.
Okay, so I'm going to ask you one. We're going to end here on a controversial question. I don't know. I say it's controversial because social media seems to have made it controversial. I think science is pretty clear on it, but let's talk about melatonin for a quick second. So,
sure.
I think giving kids an over-the-counter, gummy shaped like a teddy bear and it makes them go to sleep, that seems like the magic pill, in some ways. So is that a good idea to use with kids? Are there use cases where it is a good idea? And then what about parents who are really relying on it every night as a tool?
Okay. So I would say that, melatonin, the hormone itself, we make our own natural melatonin. Melatonin is it's the dark hormone. It tells our brain it is dark outside. Your brain should do what you do when it's dark. In and of itself, it doesn't have like a huge amount of like sleep inducing properties. So if you swallow, like I wouldn't, if I took like extra melatonin, like, 20 milligrams or something, I'm not just going to pass out and have a hard time waking up. It doesn't have those properties. And so nocturnal animals, they also make melatonin at night. And for them, melatonin tells their brain they should be awake, right? So it's not, the substance itself doesn't really have like huge sleep inducing properties. Now, there are use cases for melatonin, but it's typically when you're adjusting your circadian rhythm, because that's really what melatonin is doing for your body. It's helping set your circadian rhythm. So the main data we have is for example, adults with jet lag, for teenagers that have delayed sleep-wake phase syndrome, which is when your circadian rhythm is delayed and you have a hard time waking up at the right time in the morning, shift work, all these things have good data to support them. We also know that in certain situations, such as children that have, for example, they're on the autism spectrum, we know that melatonin can be beneficial. But if a child is otherwise completely healthy and don't have any other underlying, medical issues or comorbid neurologic issues or a history of autism, the melatonin usually does not play a role. And it's because typically the issues are behavioral in nature, particularly for infants and toddlers, and the solutions are behavioral in nature. The challenge is that we are not taught any of those solutions in medical school and residency. Even during pediatrics residency, there's very little focus on sleep disorders and sleep medicine. So being able to implement some of these techniques in a clinic visit can be hard. And pediatricians, during like a well-child check, they have to address like 50 different things in like 15 minutes. It's kind of ridiculous, right? They just don't have the time. They're pressured to,
and sleep isn't even on the questionnaire. Like sleep isn't even on the questionnaire when kids are like 3 years old. Like it falls off of the radar.
It's tough. And the challenge is, open up that Pandora's box, and then it's like, well, now what do I tell this family when they say, yes, sleep really stinks? And so melatonin ends up being a Band-Aid that some people use to say, hey, let's just try this and see what happens. But at the end of the day, it's a Band-Aid. It's not usually not the solution. So I recommend avoiding it. For my dentistry colleagues out there, whenever they hear gummies at nighttime, it probably makes their them kind of sigh, and because it causes terrible cavities, and so any gummy you definitely want to avoid. And then melatonin bottles are not FDA regulated, so they can put whatever they want in these bottles. And there have been lots of studies that show there's varying levels. Sometimes no melatonin, sometimes extra chemicals like serotonin, cannabidiol, all this weirdness. So bottom line is, talk to your pediatrician. But in most cases, if it's a behavioral issue, the solution is a behavioral solution and not melatonin.
Yep. I have anecdotally seen in my experience that kids who are given melatonin, really the kind of night after night as that Band-Aid, that it can actually cause overnight wake-ups.
Well, we know that melatonin can in some children cause nightmares, or cause more dreaming. And so that could potentially be a contributor to those that end up waking up. But depending on what time you're taking it, it can also shift your circadian rhythm earlier, which is why we tend to use it for teenagers. We want them to go to bed earlier and wake up earlier. And so you may inadvertently shift the circadian rhythm a little bit earlier. Usually it's hard to do that if you're giving it right at bedtime, but if you're giving it much earlier, it could shift you in that direction. So an earlier wake up and, potentially problems there.
Very interesting. Sleep science, gotta love
Sleep
it.
Science, fun stuff. Yeah.
Fun stuff. Okay. Well, thank you so much for your time today. I have learned so much. This is so interesting. I could ask you 1,000 other questions, but luckily you cover a lot of these questions on your Instagram channel. So at that sleep doc is where people can find you. And I will link you, of course, in the show notes. But thank you so much for your time today.
Thank you, Jessica. I really appreciate it. Enjoyed it.